Hi, it's Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing 5 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 73. While most are travel-related or connected to earlier cases, one of the new cases cannot currently be linked to travel or an earlier case. There is an ongoing investigation by public health to determine the source of the exposure and whether any other people may have been exposed. At this point, we cannot confirm that this case is linked to community spread. We're still looking to really determine or confirm the source of exposure by the person who is now a case. We do know that part of the exposure was potentially at a large gathering, a social gathering we were hearing about 50 people. That was within the rules at that time, that's one of the reasons why you have now gone from 150 to 50 now all the way down to 5 of the number of people that can get together in a social gathering. This case illustrates the importance of people adhering to the rules that we have in place around minimizing the number of people in a gathering, staying home as much as you can, self-isolating if you're required to do, good hand washing, all those pieces. When we have events that bring people together, that just greatly increases the chance of the virus being spread and large numbers of people potentially being exposed. We do know that all our 73 cases, 2 of them are in hospital, another 2 can be considered to be resolved and no longer infected with COVID-19. We are testing large numbers of Nova Scotians. To date, we've had 3,200 that have tested and been negative, as well as our 73 that are positive. We are continue to work with our colleagues in the lab, and we have significantly built capacity in our laboratories. And I really want to thank the laboratory team led by Drs. Hatchett and Dr. LeBlanc, the work they're doing. That we're now, yesterday we tested over 400 tests, and we have capacity, if necessary, to go significantly further than that in terms of the number of tests we can do on a daily basis. And that's important because as we're building lab capacity, we're also enhancing our testing. While we continue to test people with a travel history, we know that we need to be testing people looking for spread within our communities, people who haven't traveled. So we're now testing all close contacts of a case, anybody who needs to go into one of our hospital facilities with symptoms that could be COVID-19. We're testing. We're also now starting to anybody who screens in through the telehealth through 811, who screened in and directed to a test. We're going to be testing everybody now. Previously, about 1 in 5 people that were sent in by 811 didn't screen in and weren't tested, and we're changing that screening so everybody who goes to the assessment center will be tested. We're looking at other ways as well to continue to expand our testing into communities, looking for that asymptomatic spread. And we know that our colleagues in the lab are going to push them on their capacity piece, but we know they have a lot of plans in place to meet that demand that we're going to bring to them.